my name is Savannah Ross, and I'm here today to talk to you about the effect that electronic medical records have on patient privacy and just shut down a little bit of the stigma around it and answer any questions you have to have. So, obviously, we've all been to the doctor, or we've all been to the hospital, or whatever it may be, and we've seen a healthcare provider. And so with the way technology is going today, everything is going towards electronic medical records rather than paper charts or book charts or whatever you want to call it. So it's important to know how that change affects your privacy when it comes to your health information. So just a little bit about me. I'm a senior at the University of South Carolina Upstate, where I study health informatics. And I also work for the inpatient medicine department with the medical group of the Carolinas. We have about 100 providers and see roughly 300 patients a day. So that's a lot of information to protect as a administrative staff, and as a patient, I would hope that they're going through the steps to protect my information. So the purpose of this presentation is to just discuss and inform on the effect that this change through the electronic medical records has on the privacy of patient health information, and the things you can do as a patient and the things that the providers and the healthcare organizations do to help protect that information. So we're going to talk about what electronic medical records are, the opinions, the facts that surround it, and then just overall the end goal. So, electronic medical records are ways to access patient information and ways to store patient information on an electronic database. At the medical group of the Carolinas, we use a database called EPIC, and EPIC is one of the top softwares used. It's pretty easy to work, and it seems to be fairly liked by the patients. That software stores things such as appointments, billing, procedures that needs to be done, consultations, messages between the provider and the patient, whatever it may be. There's so much that Epic offers through their electronic medical records, and it can be used by anybody clinical, such as the doctors, NPs, PAs, nurses, physical therapists, occupational therapists. It can also be used for administrative purposes. I use Epic to do admission sheets and things like that. The billing department uses Epic, the human resource department. The compliance department uses Epic, and the patient also uses Epic. So there's multiple uses for the electronic medical records in all different departments, and it's important to understand that the views of each of those electronic medical records are very different. So those who are clinical, such as the doctors and nurses, they have a completely different view than the patients do, and I'm going to show you a little bit more about that, and then we're going to discuss how that affects your patient privacy. So this is the clinical view of the electronic medical record that Epic offers. It allows the doctors, the NPs, PAs, nurses, whatever it may be, home health nurse, anything like that, to go in and create notes, to see past medical history, to see what other doctors have put in their notes. At the top up here, it'll say the patient's name, the MRN number, which is the medical record number, it's an identifier, the age, date of birth, any allergies, any infections or diseases that the clinical staff should know about before entering the room. On the left-hand side, there is a different tabs for demographics of the patient, graphs of their care, lab results, medications, allergy lists, extensive family medical history, whatever it may be. In the clinical view, the doctors and nurses and everybody, they can edit, they can add, or they could change things within the medical record. The patient and administrative staffs are not allowed to do that, so that is one protection that Epic offers, is that you have to be approved and authorized to make certain changes within Epic. So as an administrative staff, I personally can't go in and alter any information. I can't go in and change any information. I can't even put in new information. I can just view it for the reasons that I need to and move on, but I can't make any edits. A doctor, however, could go in and put those edits in. I can't view patient demographics because there's no reason why I need a patient's social security number or their home address or anything like that. So it's very protective, and it's very personalized to whatever the position is of the employee, whether or not they actually can view your information. And if you try to view information that you know you're not supposed to, it'll send a flag to our IT department that someone's trying to do actions that they're not authorized to do. So the patient view of the electronic medical records looks like this. Epic uses what's called MyChart, and MyChart offers for you to have your own individual ID that you create, your own password, and if you would like to, you can use a fingerprint as well. Once you are in MyChart, you can view tests, messages, appointments, medications, health summaries, surveys, billing, all kinds of things from here. You click into it, and this is just an example of how it would look. So you would have, this is the Track My Health, and it shows blood pressure, weight, steps put in, and things like that. Those are things you can put in to remind yourself to tell your doctor. It also has medications. It says what refills you need, what you don't need, what you're already taking, how to take it, and so on and so forth. So with this view, you don't see any identifying factors. So your social isn't on here. You can go in and edit it, but it's not readily available. So that means that you'll have to call and have the department edit it, but you can't go in and edit it yourself. So if you do have a device and it falls into the wrong hands, they can see your health history to some extent. It mostly is just discharge summaries, which is what you get anyways when you leave the doctor's office. So what are the facts and opinions that surround electronic medical record implementation? It's important to understand both the facts and opinions, because the facts are reasons why the healthcare organization should implement the electronic medical record, and the opinions are things that the organization needs to understand from a patient's side and the concerns. So some facts is that it's kind of inevitable to stop moving towards an electronic medical record. Everything these days and the way technology is advancing, it's coming, and so it's just best that we just go ahead and accept it and start learning how to use it and how to adapt to it and how to protect ourselves. Some of the opinions is that people are concerned that it's going to be difficult to learn and that their information isn't going to be as secure. But as mentioned before, there's many things that go into an organization using an electronic medical record, and there's many things you can do, like the fingerprint or the password and so on and so forth. So it's reasonable to be worried about your patient information, because that's personal information. And another concern right now is how many hackers are out there and how many breaches we've seen. But hopefully, as it becomes more normal to have an electronic medical record system implemented into organizations, there'll be more of a standard. Right now, there are many laws and regulations and fines that organizations can get if there are breaches, but hopefully we can get a step ahead of the hackers and stop all the breaches altogether, or at least lower them dramatically. But overall, organizations truly focus on making sure that your information is private and protected, and you can do stuff to help that as well. So don't share your passwords. Don't tell people that you even have an electronic medical record on your device or tablet or whatever it may be. And just really keep that personal to yourself, just as the organization does. So if there are any questions, I'll be glad to answer them, and here are other resources if you would like to go look at them. Again, my name is Savannah Ross, and I'll be hanging around afterwards to answer anything you may have. Thank you.